Here is your question. In the exam, by the way, you'll be given 8 minutes to read and prepare the scenario, and then bell will go, and then you'll go in the second day to do this station. Right. So if you have read and understood, considering it communication skills station,
Okay.
can you please begin?
Okay, I will knock the door and say hello. This is Dr. Malik from the surgical ward here. May I confirm that I'm speaking to Mr. Ahmed?
Yes.
Hello, Mr. Ahmed. Nice to meet
Um,
you.
Nice to meet you, doctor.
Yes, I've been told from my nurse staff that you have some concerns regarding uh, your warfarin pills. Is that right?
Yes, that's right.
Yeah.
I'm actually I'm taking these blood thinners tablets 5 years ago. I have undergone some operations due to my heart issues. I have undergone metallic valve replacement. So my surgeon prescribed these blood thinners for me, and he told me that I should not stop them. So is it a problem to stop them?
Okay. All right. Yeah. So your concerns now about to stop the warfarin pills. Am I right?
Yeah. Yes.
Yes. Yeah. So let me just tell you something while
Yes.
we discussing the issue. Yeah, your warfarin pills has been given to you to prevent your body from forming a thrombus or a clot over your mechanical valve. Okay, and now you've been scheduled for a herniatomy, a repairal for your inguinal hernia, and there is a possibility that uh, there is a bleeding tendency here in this situation. So we need it to stop the warfarin, and at the same time we need to give you another drug has the same virtue as warfarin by liquefying your blood. So this is what we
Yeah.
are aiming to.
And what are the differences between warfarin and this new drug you will give me?
Okay, that's a good question. Yeah, warfarin actually is a strong and potent, long-lasting drug. Okay, and the drug we are aiming to give it to you is a short-acting, okay, blood thinner as well. And the second difference is in the mode of uh, the mode of um, not the mode is how to have it. So the warfarin usually acts when you take it orally or when you ingest it, swallow it. And on the other side, the heparin, the other drug, is injection into your skin.
And that means that after operation, I have to continue on these injections on my skin for life?
Not for life. I appreciate that is a lot to come in one session, but let me just make it easier for you. So now after your operation finished, okay, and you're starting to take orally, we will give you the warfarin again, okay, and because the warfarin needs some time to work, okay, on your body at least 3 times. These 3 times will be covered by the injection. So you will have your injection for extra three days after the operation. Just for the period to let your INR within range and to let your warfarin get in action again.
And do you mean that I will stay at hospital after my operation for that 3 days?
We will be pleased if you can stay with us here for the 5 days because we are targeting to to stop the warfarin and start the new drug in 5 days prior to operation. But if you have some circumstances, okay, then yes, I can speak to my consultant, and then we can speak to your local GP to appoint a district nurse to come to your place and to learn you how to inject yourself, because it is already pre-filled injections, and we can give you leaflets about that. So are you totally blind or partially blind?
Actually, I'm totally blind. I'm taking some medications rather than warfarin. I'd like to ask about them. Should I stop them too? I think they are diazepam. Should I
No,
should I stop them before the operation?
no, there is no need. There is no need to stop your diazepam or your other medication before the operation. Okay, like warfarin, 5 days before the operation. You can just continue to have him with a sip of water till the morning of the operation.
Okay, that's reassuring. Thank you.
Thank you so much. Do you have any question?
No, thank you.
All
I
right,
have
so
to
let me
understand.
wrap up what we have been through. So now I've explained to you why we are bridging your warfarin with the heparin, and you are happy to have your heparin injection with the help of the district nurse at your home, because you have some circumstances and you need to stop the warfarin 5 days and to start it as soon as your operation finished and you start to take orally. The period when there is no warfarin, you will be covered with heparin, and the heparin will stop just 12 hours before the operation, because there is a tendency of bleeding during the operation. After the operation, we will continue the heparin, sorry, for up to 3 days till your warfarin get in action. Okay?
Okay,
All right.
thank
Thank
you.
you so much, Mr. Ahmed, and hope everything will get better soon. And we'll keep my number with you just in case if you wanted to speak to me at any time. I'm really happy to help.
Thank you. I really
So,
appreciate that. Thank you.
thank you so much.
What else at the end?
Give him a leaflet, but he is totally blind, so I cannot give him a braille or large print or anything.
No, but this is counseling for warfarin. So if patient agrees to stop warfarin and allow you to give heparin meanwhile, so you would have to ask him to give consent.
Okay. I think he looks happy about the consultation, but I need to make sure that he's consenting about starting.
Yes.
Okay. So, Mr. Ahmed, are you happy to go for this plan of action?
Yes, sure. I totally understand it now. Okay. Is verbal consent enough for this station? I think yes, because the patient is blind.
Blind, but then again, doctor has to write it down that he has asked you clearly and you have given your consent, so that patient is blind but mentally stable, so he can give consent, and you can say that you've asked, and it will be doctor's responsibility that he is taking clear, defined consent, because patient will be being operated for inguinal hernia, so that needs to be 6 seconds left. Needs to be taken. Yes. Right. Now bell has gone. All right. Thank you. Would you? Good. Thanks.